In the beginning of August, my mom had told us she had a tumor in her breast, and tests later revealed that it ended up to be breast cancer. It was a very, very scary time for my whole family. We didn't know what was going to happen, so we started learning more and more about breast cancer, and it eased our anxiousness because so many people had it, and it is so treatable. So here's some general information about breast cancer. About 1 in 8 women will be diagnosed with breast cancer in their lifetime. 95% of breast cancers in the U.S. occur in women 40 years of age or older. There are several different types of breast cancers, but they can be categorized into 2 broader categories, which would be invasive and non-invasive. Non-invasive breast cancer is where cancer cells remain in a particular location of the breast without spreading to surrounding tissues, lobules, or ducts. Invasive breast cancer is where cancerous cells break through normal tissue barriers and they spread to other parts of the body through the bloodstream or lymph nodes. Breast cancer is also classified based on where in the breast the disease started, which would be the milk ducts or lobules or other places, and how the disease grows and other factors. For invasive breast cancer, it accounts for up to 70% or more of breast cancers. Sometimes the origin of the tumor may not be known, and sometimes the cancer can be both invasive and non-invasive, which that basically just means that some of the cancer cells have grown into normal tissue and some have remained in the ducts or lobule. Ductile carcinoma. If DCIS lesions are left untreated over the time, cancer cells may break through the duct and spread to nearby tissue, it would become an invasive breast cancer. DCIS is the most common type of non-invasive breast cancer, and it accounts for 60,000 new cases in the U.S. each year. About 1 in every 5 new breast cancer case is a ductile carcinoma. Inflammatory breast cancer, IBS for short, it usually starts with the soft tissues of the breast and causes lymph vessels in the skin of the breast to become blocked. As a result, they become firm, itchy, tender, red, and warm due to increased blood flow buildup of white blood cells. This kind is very rare, and at first it's usually diagnosed as an infection, but it grows very fast and aggressively, and it's not usually diagnosed cancer until stage 4. Male breast cancer, it occurs when malignant cells form in the tissue of the breast. It's most common in males who are 60 to 70 years old. It's very uncommon in males' breasts to have ducts that are less developed and are exposed to growth-promoting female hormones. And metastatic breast cancer occurs when the cells spread to other parts of the body, but they travel through the bloodstream. Papillary carcinoma. In papillary carcinoma, the cancer cells are arranged like finger-like projections like I have in the picture. It looks like that under a microscope because they appear to be like fern-like. It accounts for 3% of all breast cancers, so it's really rare. In triple-negative breast cancer, in TNBC, the cancer cells do not contain receptors for estrogen, progesterone, or HER2. And 10 to 20% of all breast cancers are triple negative. Healthy breast cells contain receptors for hormones, estrogen and progesterone. They also contain receptors for a protein called HER2, which stimulates normal cell growth. About 2 out of every 3 women with breast cancer have cells that contain receptors for estrogen and progesterone. About 20 to 30% of breast cancers have too many HER2 receptors. When it comes time for the doctor to determine the best way of treating the disease, they look for specifics of the tumor, including if the disease has spread beyond the breast and what type of tissue where the disease began. Some of the most common treatments is surgery, radiation therapy, chemotherapy, hormone therapy, and targeted therapy. For surgery, some of the surgeries would be a lumpectomy, total mastectomy, double mastectomy, and radiation therapy is where cancer treatment that uses high-energy X-rays or other types of radiation to kill cancer cells or to keep them from growing fast. Chemotherapy uses drugs to stop the growth of cancer cells, either by killing the cells or stopping them from dividing. Hormone therapy removes hormones or blocks their actions and stops cancer cells from growing. Types of treatment and targeted therapy is a type of treatment that uses drugs or other substances to identify and attack specific cancer cells without harming the normal cells. This is only just a top layer of information about breast cancer. If I went through all of the details, I would be here for days. There's so much more to know about this, and doctors are continuing to work more and more to learn more about it. And I'm so thankful for them because today my mom has made it successfully through 2 surgeries and is now cancer-free.